Hello, my name is Gretchen Kohler, and for my op-ed assignment, I decided to focus on depression screening of high school students. Mental health is a critical aspect of overall well-being, particularly during adolescence when individuals undergo significant physical, emotional, and social changes. Depression is a prevalent mental health disorder among high school students, and early identification and intervention are essential to mitigate its potential negative consequences. Mandating depression screening for high school students can be an effective strategy to detect signs of depression early and provide appropriate support, thus fostering a healthier and more productive youth population. Depression is a major source of impairment and suffering in adolescence and is considered to be an important remediable risk factor for suicide, which is the second leading cause of death among adolescents in the United States. Depression in adolescence predicts depression and anxiety in adulthood, and most affected adults had their first depressive episode during adolescence, highlighting the need for early identification and treatment. Although the prevalence of depression has increased across all age groups, the increase among adolescents has outpaced that among adults. The lifetime prevalence of major depressive disorder among 13 to 18-year-olds is now 11% in the United States. In 2021, an estimated 5 million adolescents aged 12 to 17 in the United States had at least one major depressive episode. This number represents about 20% of the U.S. population aged 12 to 17. Additionally, 36.7% of high school students reported feeling sad or hopeless, and 18.8% seriously considered attempting suicide. Thus, it is essential to be able to notice the signs and symptoms of depression in children and adolescents and know best practices in order to support and intervene. Overall, we need to improve both the mental health of our youth and the timeline from which depression symptoms begin and the subsequent treatment that they receive. This goal can be achieved through mandated depression screening of high school students, as schools create a more equitable setting for screening given that most adolescents attend regardless of race, ethnicity, and socioeconomic status. The main argument against mandated screening is that this is the role of a youth's primary caregiver or primary care provider. However, a national survey from the Substance Abuse and Mental Health Services Administration showed that in 2021, about 60% of adolescents with a major depressive episode did not get treatment. Many lack routine preventative health care, limiting the ability of primary care providers to address this worsening public health concern. This indicates that the current route for adolescents to be diagnosed and subsequently treated for depression in the United States is severely inadequate, and another strategy must be implemented. In 2021, a randomized clinical trial by Secker et al. Noted that early identification leads to timely intervention, meaning that mandating depression screening allows for the early detection of signs and symptoms of depression in high school students. Adolescents often face immense academic, social, and familial pressures. Thus, identifying depression early can lead to timely intervention and support, preventing further deterioration of mental health. Secondly, they found that reduction of stigma and normalization of mental health conversations. By incorporating depression screening into routine high school health assessments, we destigmatize mental health discussions. Mandating screening signals to students that mental health is as important as physical health, encouraging open dialogue and reducing the fear associated with seeking help. Thirdly, prevention of long-term health and economic burden. Depression, when left untreated, can have long-term detrimental effects on an individual's health and economic productivity. By mandating depression screening in high schools, we invest in preventative health care, potentially reducing the burden on healthcare systems and the economy in the future. Next, promotion of resilience and coping strategies. Mandated depression screening can be coupled with mental health education, teaching students coping mechanisms, stress management, and resilience building skills. These strategies equip students to navigate challenges effectively, promoting better mental health and overall well-being. Addressing mental health concerns can also positively impact academic performance. Students dealing with depression may struggle with concentration, motivation, and attendance. Early identification and appropriate intervention can help manage their mental health, leading to improved academic outcomes and a more conducive classroom environment. Fifth, parental awareness and involvement. Depression screening in high schools can serve as a tool to enhance parental awareness of their child's mental health. Parents can be informed of the results and collaborate with schools to ensure their child receives appropriate support, fostering a stronger parent-school partnership and nurturing the student's mental health. Such depression screenings are also supported and endorsed by the American Academy of Pediatrics and the U.S. Preventive Services Task Force. In conclusion, mandating depression screening for high school students is a proactive approach to address the critical issue of mental health. It emphasizes the importance of early identification, reduces stigma, improves academic performance, prevents long-term health and economic burden, promotes resilience, and enhances parental involvement. By prioritizing the mental well-being of our youth, we pave the way for a healthier and more productive society.